Hey folks, General Manager Tony Mazzucco coming to you with our weekly Town of Norwood Facebook Live update. We will be talking about COVID and a few other items, and we have a few numbers to go over. So as always, we'll get going in just a few moments as folks tend to log on. We've got some good news with our COVID numbers and some updates on a few other items. So we're looking forward to going through that, and I've got some interesting charts to show everyone. One day we'll actually learn how to use the screen share function properly, but until I'm able to do it, we'll continue to show you the paper printed copies. Hey Catherine, thank you for joining us. If Sarah Quinn's on the line, the library's still opening August 3rd, so no need to stay through the whole thing if you just wanted that information. Hi, folks. Hi, Katie, Michelle. Thank you for joining us. We are going to get started in just a minute. I'm going to get my chart ready here as everyone logs in. Well, thank you for joining, everyone. I've got this chart here. These are some extra papers that we don't need. I've got that announcement, and I've got really the two charts I need. So, good afternoon, everyone, and welcome for our weekly COVID updates and a few other updates. I'm going to jump in as I usually have been doing with the, let me just close this menu here, with our COVID numbers. And our case count is up a giant whopping 1 from last week. So our case numbers continue to grow slowly. But I want to talk about where we're seeing some of those case counts come in. We've had a total of 9 in the last 14 days, 1 in the last day. So we're a little concerned where we're seeing our numbers come from and what looking at state data and national data, international data that's out there and what the health department's looked at. A lot of it seems to be coming from folks having parties. Now, I know I sound like the ultimate downer when I say don't go to have parties or don't have parties, and we're not saying not to have that. But it seems like as we sort of work our way through COVID, there's two ways we approach how the spread happens. One is the science and the data that we know based on decades of public health data and infectious disease control. And the other is as you have a new communicable disease in COVID, you've got to look at what data you have. Now, we make an assumption at the state level and at the federal level about transmission in movie theaters, for instance. But there haven't been any extensive studies over whether COVID spreads in movie theaters versus not spreading in movie theaters. But we do know from what we're seeing at the local level, at our numbers, that's being replicated everywhere there throughout the country, is parties really are a place where there's a lot of spread. That's one of the reasons most states aren't allowing bars to open up. Now, I know some folks are thinking, I go to the bar with my girlfriend and we sit there and we have a drink. What's the risk of spread? The risk of spread there is minimal. But picture a bar, a club with 40, 50, 60, 70 people there all together, and you're walking around, you're mingling, you're bumping into people, you're very, very close to people. There's a lot of spread there. It's the same thing with a party. Think of your typical backyard cookout party in the summer, whether it's a birthday, whether it's 4th of July, or just a celebration. Think of how much you are closely interacting with people. You come to the house, you see the host's spouse, you talk a little bit, you chat a little bit. You then go see somebody you know, you say hello to them, and it could all be family. You then go to the food table and somebody hands you a burger, and then you go and you have a drink, and you're sitting here and you're talking to this person. Now, some folks are introverted. I sometimes like to go find a corner in a party and sit there and play on my phone. But the average person at a party, you're going around and talking to a lot of different people. And then unfortunately, as you continue to spend time at a party or family event, if people are consuming alcohol, that adds to your overall level of interacting with people and being friendly with people. And let's face it, we're all adults here. You've had a couple of drinks, other people have at a party. You're a lot more likely to walk up to somebody and chat with them, to talk to them. You're generating more and more droplets. Parties really are, when you have a lot of people in a small area, super spreading events. And that's where we're seeing some of our numbers come in, is that, well, I went to this party. And most of these parties that people are going to are fairly innocuous. It's, we had a little bit of a backyard get-together for somebody's 50th birthday party. Or, well, we just had a few folks over because we haven't seen somebody in a few months. And we're not encouraging folks not to have or hold parties or events, but just be careful. If you normally have a cookout every year at the end of July with 60 people there, you may want to tone it down to 20 or 10 just to try to keep it to a few people. The same thing with family parties. It becomes very difficult when you want to celebrate a milestone, weddings, births, anniversaries, whatever it happens to be, and you have a lot of people getting together at once. That can create a problem. Those events are big, big spreaders. And where we're concerned is, as you know, maybe not Norwood, but somebody may live in Sharon and they have a party and they invite 30 people and 30 people come, but they're from 7 different towns. So all of a sudden, if you were just sort of going about your day in your home and you had a couple neighbors over and maybe you had somebody from the town next door, that's one thing. But now you have these 30 or 40 people, somebody gets exposed, and then it's growing out to 7 different towns, and then they go about, and then it goes out from there. So the message there is, even though our numbers are doing phenomenal, both locally in Norwood and throughout Massachusetts. And we're going to talk about some of the national numbers in a minute. We just want people to particularly be cautious about going to parties, and when you go to a party, try to maintain the social distancing. Try to wear your mask where you can. I know nobody wants to go to a party and be like this the whole time, but we're seeing those with the little bit of spread we have. That's where we're seeing a lot of it come from, is at parties. I mean, the science has shown that the casual interactions of going to the grocery store, the likelihood of catching COVID there is minimal. If you think about a restaurant, if you go to a restaurant and there's even 50 tables at this restaurant and there's 5 people at every table, your interaction is generally the waitress or waiter coming to your table, the host or hostess, and the people at your table. Maybe you get close to somebody when you go past them on the way into the bathroom, or you walk by a table. You shouldn't walk by a table and say hello to people. It's human nature. It still happens. But you can go into a restaurant with 200 people, and your actual exposure is 7 or 8 people, max. You go to a party with 40 people, and your exposure could very easily be 20 or 30 people. So when you think about controlling the spread of a disease, that's one of the challenges with these larger events or going to a party, is I could be in a circumstance where there's 200 people in a building, or where there's 25 people outside, and the exposure could actually be worse, even though outside is far superior to inside. 25 people at a party can even be worse than 200 people in a enclosed area. Question from Kate: are the Norwood COVID numbers down because the hospital is closed? No, our testing numbers actually have not changed. We have had 643 tests in the last 14 days. In total, we've had 6,200 tests. That's in the community, or that's people from Norwood. So I don't want to say that's just tests that physically took place in Norwood. So 10% of our testing was done in the last 14 days. So we're still testing at a very good clip. And remember, you're going to go somewhere to get tested for COVID. So wherever you go, that gets reported back as a Norwood case. So if I was in Boston, or I went to a hospital in Boston and I get tested in Boston, I would still be counted as a Norwood case. And we've always had a fairly aggressive testing program, but the longer, most of our tests haven't been done physically in Norwood. I'll give hospital updates a little later on as we go through the COVID updates, Paul, but I'll give some specific updates on the hospital, although the main update is still no real updates, other than they're still looking at 3 phases, probably 60 days for the ER. They found that there's a lot of damage that needs to get reconstructed or needs to get fixed to get the ER up and running, and then it's looking at how much do they repair versus rebuild. So the hospital's going to be a long time frame, but we're still hoping for, now they're thinking 45, 60 days for the ER to get up and running. But I want to go back to COVID numbers to show a couple of things. We've had 11 positive tests in the last 14 days. I think I said 9 earlier. 11 tests, which includes the serology tests. Our rate jumped a speck above the state's average. The state's at 1.67. We're at 1.71, still within the margin of error. And with so few tests, a handful of tests are could throw it one way or another. But I want to show everything. If everyone remembers back to March and April, we were all talking about flattening the curve. And there was a little misconception there about what that meant. I think some folks thought, well, we flatten the curve and it goes away. Flattening the curve was a way to make sure we could not overload the healthcare system and not overload the hospitals and not have the spread reach a substantial majority of the community. Well, we took one of the charts that we track every week of our weekly case count, going back to the 1st of March when we had 6 cases that week. And we normally run this chart. I usually show it. It's a red and a blue line with the total case count. What you've seen is the total case count went up, and then it's kind of flatlined or just gone up a teeny bit. Well, we pulled out that chart and said, what's our actual instance of positive tests for cases? And this is what the chart looks like. That's exactly what was predicted when folks talked about flattening the curve. This was exactly what, if you remember, in March, everyone said would happen. And if we took strong action, we locked ourselves in our homes, we closed businesses, and it was devastating. We wore our masks, we stayed away from friends and family. That's exactly what would happen. I mean, look at that. 5th of April, 107 cases in a week. The next week we had 96 new cases. Then it dropped a bit, but the next 5 weeks were between 30 and 45 cases, whereas now it's 8, 9 counts in the last few weeks. So we flattened the curve. We did what the science said it would do here in Norwood. Now, the only chart I have from Massachusetts is a little bit more it's pulled off a very reliable source known as Google. The challenge with this chart is we have these two weird spikes here. And a question from Christine, I want to know why it's so difficult to get through to the smoke detector person and why the person who answers town hall has no idea what I'm talking about. I'm not sure I understand what you're talking about. If you're referring to needing a, it's either going to be the building inspector or it might be the fire alarm, the fire inspector. We are currently down a fire inspector due to some internal promotions. If you could send a specific email to managers@norwoodma.gov, we'll make sure it gets forwarded to the correct office. The Massachusetts chart shows two strange spikes that must just be an inaccuracy in the data that Google has reporting. But I want to show a couple other charts. This is, no, I don't want to show that one yet. That's my punchline, if you will. This is the state of New York. So here's New York's numbers. They too flattened the curve. Now some of the spikes in the data there, but you'll notice their numbers here, July, pretty nil. They flattened the curve. Now let's take a look at Florida. This is Texas, I lied, this is Texas. Look at where their numbers are. Now this is interesting for two reasons. One, back in April they weren't seeing the same case count that we were seeing in this part of the country. But you'll notice their numbers have gone up to a pretty high level, levels that I don't think we actually ever really saw in Massachusetts. Same thing in Florida. They had comparatively low numbers, although this would be a moderate number for Massachusetts. Here, up. So whereas Massachusetts has seen our numbers go down, New York, Connecticut, numbers have gone down. Maine seems to be all over the place, but the very small states like Maine and Vermont, which are doing well, 5 cases can throw their numbers off. Christine, we're sorry about that. They had a call a few times. Sometimes it's what somebody's looking for. We understand it as, we know it as something different, but just send us an email and we'll make sure it gets sent to the right person. So the challenges we're facing in our numbers, Massachusetts is doing great, Norwood is doing great, other parts of the country aren't doing as great. And it's possible that, well, I would never say that they didn't shut down soon enough, it's possible that the spread wasn't as heavy in those states earlier in the year that it was here, so it wasn't necessarily taken as seriously, where they said, well, gee, this really isn't anything to be worried about. And then what we saw is our numbers were way up here, their numbers were down here, we acted, they chose not to. They're now facing the same challenge we are. Now the challenge for them is they may now have to go back into some of the shutdowns that we saw when our hospitals were filling up, the death count was very high. We've all been here, we've all seen the numbers that came out of our nursing homes where 10 or 15 people were passing away at once, and we've largely gotten that under control, although COVID is still very deadly, especially to those in nursing homes. You're going to start seeing that in Florida and Texas and in Arizona, I looked up as well, and some of the other states. So I'm not smart enough to put together what the global solution is, but it seems as if we've done things right. We want to continue to do them right because we don't want to see our numbers spike back up. I don't think that this is a second wave for some of those states. It's probably still really their first wave. There's some discussion among infectious disease control experts that, you know, if indoor air is generally worse than outdoor air, we in March and April tend to be indoors quite a bit, whereas folks in warmer climates tend to be outdoors when the weather's a lot more pleasant. But now that it's July, and even though sometimes the weather gets hot, we tend to spend more time outdoors, and folks in much warmer states tend to spend less time outdoors when it's, you know, 90 or 100 degrees and humid out. That's merely speculation. There's not a lot of science behind that yet, but we're wondering if that's one of the reasons we're seeing that you just have numbers that are not remotely matching up. I mean, this is a large country, so there's certainly not an easy solution. But we want folks to continue to wear your masks, reduce your exposure where you can, and especially be cautious about going to parties or events where there's a lot of people. We know what's going to happen, but and it's just a matter of be careful and try to do what you can do. Always monitor your own symptoms, and if you think you're not feeling well, please stay home. Related to that, I want to talk about our process, which is based on state law, and we're a little bit different because we have a number of essential employees for people traveling out of state. Technically, anyone traveling out of New England, you're supposed to self-quarantine for 14 days when you get home. Medical professionals are exempt for that, as well as a number of other exempt employees, considered essential, municipal employees, public safety, police, fire. We're required to self-monitor symptoms and self-monitor twice a day and report to our supervisor what those symptoms are. However, if you are not an essential employee and you travel out of the New England area, you're still supposed to self-quarantine for 14 days. These rules change regularly, so they'll continue to change, but that's the current rule, and now that's the practice that we would follow here for town buildings. Speaking of which, I'm going to talk about just briefly the library will be opening for limited in-store, in-library browsing on August 3rd. The library's done a great job. Incidentally, Liz Reed from the library was awarded a $7,500 grant for a civic discourse program in the fall, so kudos to her and the library for doing that. I'll talk about Town Hall in just a second. The civic is now open for using the gym. You have to make an appointment ahead of time, but the workout facility is open. We're starting to get people into there slowly. Town Hall still not going to be open until Labor Day. The elevator is still down at Town Hall, and for us to meet our ADA requirements, the moving of staff and equipment and material between the floors, given COVID, even if you didn't have COVID, makes it next to impossible to do that. We will be looking to get the building open as soon as the elevator is up and running. But it's important to note with Town Hall, every single service you need from the town is available, whether it's over the phone or digitally. There is no service that you cannot access either digitally or over the phone or by mail. 100% of our services are available. So you can call us, you can email us. It may take a little time to get through. We're experiencing higher than normal call volume and email volume, but any service you need from the town, you can do. Now, one of the things I want everyone to think about as we move forward into a post-COVID world, or what we hope is a post-COVID world, what interactions are more valuable than others, and what interactions do you have? Because remember, every interaction is a chance of exposure, but what interactions do you need to have, and are the things you don't necessarily need to do that you'd rather save for some other interaction? Perfect example is Town Hall. Now, some people like to come in and go to the window, and we have wonderful, friendly people that work at the treasurer's window. I like to say hello to them most mornings or every morning, and they're a great group. So you like to come in and pay your bill to the person at the treasurer's office, and they're behind a shield, to be honest with you, so it's reasonably safe. But you're exposing yourself, you're exposing other people in a building for a service that, depending on how much joy you get out of it, you could do online. Now, I personally don't feel the same way about shopping. I like going to a store and buying stuff. I do order, like everyone, more stuff from Amazon than I should, but I appreciate being able to go to a store and go to a grocery store or go into a restaurant. So if I could find other things that I'm doing that I could do digitally, I would rather do that. I've not done telehealth yet, but if I could avoid actually going into the doctor's office and just doing telehealth, believe me, I'd love to do that. So as we begin to reopen facilities, you want to support businesses, and specifically local businesses, but if there are things out there that you maybe don't need to do, look at what the alternative is. Can you mail something in? We have a great postal service. Can you do something digitally? Can you drop something in a mailbox and be able to just reduce your interactions without possibly hurting the business community? If the volume were to drop off at Town Hall of folks coming in to pay bills, we would certainly miss everyone, but it's a chance to look at what digital services are available. And mail is, I love getting mail. Mail's always a good indication of, or mail's always quite a bit of fun to receive. Question from Jane, in real life, what is the likelihood of anyone returning home after vacation and having an additional 14 days to self-quarantine? I don't see how that could happen. It's like we have no proof that people have been washing their hands since COVID began, but you hope to God people will wash their hands. You hope when they leave that they take precautions. And again, it's about the totality of somebody's actions. You could go to Dallas, Texas right now and get exposed to COVID. You could also go to your neighbor's house and get exposed to COVID. If you are somebody who is generally in risky situations and not generally following the rules, you're going to be a higher risk versus somebody who maybe you do travel to a high-risk state. And Massachusetts has said anywhere outside of New England, even though there are some states out there with lower rates than us, and they're required to quarantine. Some people are going to do it, some people aren't. It depends on what you're doing. You really got to decide whether or not you're concerned about your fellow people in society. So, I'm an exempt employee. I travel out of state. I would have to come back in and self-monitor and twice a day check my symptoms and, report them in that, to the health department that here are my symptoms and I'm temperature-free and I don't have a cold and I don't have a cough, etc. Let's say you go to Florida for a week and you come back. You may physically be unable to take time off of work, but that's a consideration you should make and you should let your employer know that. And are you going to come back on Monday from Florida and then Tuesday go to a party with a lot of people? Again, it's about the totality of your actions with public health. So It's a matter of the more you do, the more you can reduce it. Will people reasonably always do it for 2 weeks? No, it's not always going to happen. But take a look at your total actions and what your commitment to fellow people are, and make your choices there. I hope everyone washes their hands several times a day. We have no way to prove that everyone's washing their hands several times a day. Somebody said not going there for 14 days, didn't want yeah, so Julie said she plans to return from Michigan, grocery shop at Staples before I left, grab perishables in Michigan before I leave, and then not going anywhere. That's similar to what I'm planning to do. I'm planning to be out of state in August. I'm taking care of as much as possible ahead of time, and then when I come back, I'm still required to, I can work from home periodically, still required as an essential employee to report to work and report my symptoms. So twice a day, I've got to get my temperature checked. I've got to report into the health department what my symptoms are, and that's how most of our employees would have to do it. But I'm going to plan on reducing my exposures as well. Not that I go to too many large parties, but I'm going to be a little bit more cautious about eating out. I'll still do it here or there. I'll be more cautious about wearing my mask, more cautious about washing your hands. That's what we all want. Because again, you could get exposed in Florida or Michigan or California or anywhere. You could get exposed talking to your next door neighbor. It's about the totality of your actions and planning and doing everything you can do to reduce the potential exposure. I think Miami right now is experiencing huge numbers. So if you go spend a week or two down in Miami, you also got to look at what you're doing while you're on traveling out of state, and understanding some people are going to travel out of state for medical reasons. Some people are traveling to see family. You may be traveling for a wedding. You may be traveling, unfortunately, for a funeral. So if you're going somewhere and you're limiting your exposure yourself, then there's very little risk, and it's absolutely about personal responsibility. If you go to Florida and you're going to Florida specifically to spend 2 weeks at all the clubs and the bars, and I actually think the bars may be closed, but I could be wrong in Florida, and all this time on the beach and going out and going to tons and tons of really big parties, well, you're going to want to do a hard 14-day quarantine. If you're going to Michigan, which I think has relatively low numbers, and you're just spending some time with family and maybe going to the lake here or there, and there are no crazy parties, and there's not too much exposure, you're probably likely pretty safe there. Bob asked about, can you give us an update regarding the funding NORAD receiving from the CARES Act? Yes, so we're eligible for a little over $2 million in CARES Act funding. To date, the pandemic has directly cost us, and this doesn't count our lost revenues. This is just expenses. We're around $800,000 or $900,000 in terms of CARES Act related costs. A lot of that is PPE. A lot of that is temporary staff and support staff and overtime related to COVID. A lot of it is work on our buildings. We needed to buy the school department some equipment. I think we spent a little over $200,000 on Chromebooks to make sure that we had everything we needed going into a potential fall, which we don't know exactly what schools will be doing, or whether it's hybrid or on, in person, or fully digital or fully remote. So we're eligible for about another $1 million or so in CARES Act funding. That the only fear I have is the government is saying that I am the government in some cases, we are here, but the other levels of government that have all the authority and make all the rules are saying that money likely needs to be used before the end of December, because that means that the emergency is likely over by the end of December. I'm hoping there's an extension to that, because what we don't know, we know less than we don't know. Or I should say, the amount that we don't know is pretty high. One example is we don't know what the burn rate or the use rate for PPE at schools is going to be. Are they going to need 50 masks a day for students who forget their masks? Are they going to need 500 masks a day? We're developing plans, but sometimes you don't actually know. Now, there are certain things we did early on that we know we now don't need to do or wouldn't do in a certain way again, but we haven't gone through a full year or two. We don't know what the replacement rate, for instance, is for like plastic shielding. So we bought that for some places where we have desks, and plastic lasts forever, but at some point these things are going to get knocked off desks, they're going to get broken, you're going to need to replace them. Now, that's not a huge cost. However, how many of those are we doing in a given year? I don't know. Do we need $5,000 a year? Do we need $10,000 a year? I certainly don't want to order them and stack them in a warehouse and not have to use them. But there's sort of how much money do we need to operate, and then what happens if we have a second wave? So our plan is going to be, can we have as much of that funding as possible? And we're going to fight to hold on to it, because we had a lot of high volume at our citizen call center. We've been able to reduce the number of people we have working on that because we've opened up some other town services. Well, what happens if that number goes way back up? What happens if we're right back into phase 2, phase 1? Our cost level is going to go up even higher for being able to do that. So we've got enough funding to get us through for our COVID-related costs. However, if that funding dries up as of the 30th, then it's all of a sudden going to be, well, what are we doing? I need maybe $100,000 a year, $200,000 a year in COVID-related funding. So it's going to take us time to really adjust to what the normal in the budget is. And prices continue to fluctuate on items as well. Another issue is we are using, through across a number of our divisions, we're renting vehicles temporarily to maintain one person, one vehicle. If we're to do that permanently, it's not an enormous cost. It could be $250,000, $300,000 to acquire a few additional vehicles, but we're not supposed to be able to acquire vehicles with CARES Act funding. Well, all right, that makes sense. It's sort of dealing with the immediacy of it, but the immediacy is I need more vehicles than we have because we're trying to maintain one person per vehicle. So I now need to go and find $300,000 to cover those costs. And then some of our workstations are fine on a temporary basis, but sometimes they need to be updated on modified on a permanent basis. And we're still not operating at full capacity in a lot of areas. So the library is just opening on August 3rd for probably half days. So I'm not going to know until much later into the fall, what is it like doing all of these different functions through COVID, and what's the additional cost there. So I'm hoping that while the short term we have enough money to cover COVID direct expenses, that there's some flexibility to let us hold on to that money as we adjust and learn and as time goes. I mean, camps, it's all new to us this year. Extended day, all new to us. The pools, all new to us. And then when school opens in September, however that happens, that's all going to be new as well. And they're looking at different funding sources and what money can come in to cover this versus that, so we can take care of that. There's a larger issue about what the impact on the revenue of the budget will be, and we've taken a number of steps to look at that. Remembering that most of our revenue comes from the property tax, which remains pretty stable in recessionary environments. Some of our revenues subject to fluctuation. It's really state aid and then excise taxes. Other things go up and down with the economy, but out of $150 million, $140 million general fund budget, more than half of that is property taxes. The next biggest item is state aid, so where state aid comes in will be an item, but state aid has never, knock on wood, this is a tough year, they've never just slashed state aid 30 or 40% from its current number. So it's a possibility that we'll have to, adjust to that in subsequent budget years and look at where our revenues are. But the CARES Act funding it's been helpful so far. I just worry about that December 30th drop-off date where it's, well, the emergency is all done, so, you no longer need this funding. Nor was it intended to be a permanent source of funding to deal with COVID, but COVID's not going to be necessarily over by December 30th, because one other area where we're looking at the allocation of our funds is, assuming a vaccine comes out soon, those are distributed at the local level, and we, like every town, have prepared and planned for pandemics to the extent that we know how to mobilize and get vaccines out to the public. The frustration among public health and public safety and emergency management professionals has been that for decades, really, for at least well over a decade, it's always been you don't need to stockpile supplies because if there's an emergency, the federal government will step in and the National Strategic Stockpile will step in and take care of everything. That didn't happen. So a little poor planning on their part, and not that you want to ignore the federal government, but now it's like, well, maybe we should be stockpiling supplies. That being said, we don't know what costs we would have to bear for a mass vaccination. I mean, we know some staff costs and mobilization costs, but are we going to need to purchase them? Do we need to purchase part of the delivery device? So we want to make sure that we're holding on to some of that CARES Act funding as well to cover those costs for distribution of a vaccine should that be ready to go in the fall. So it's a complicated answer, but it's we're hopeful that it'll end up coming through. Ralph commented that he's retired, can volunteer to help if needed. I can tell you if we do end up having to do a mass vaccination, believe me, there'll be a large call for volunteers, and the health department will, of course, take the lead in that. But we, as of yet, nobody has a vaccine. We're hopeful that some come out and that they can start getting distributed. But that's an area where our COVID numbers, where some of our CARES Act funding will like to go. We are waiting to see what the federal government does with the HEROES Act, or it was proposed by the House to be the HEROES Act. The Senate wants to call it something different, and whether or not some of those funds will go to the states, either directly or indirectly to cities and towns to help us out with lost revenue and other items. The easiest way to do that would be to hopefully get that money to the state, let them plug their budget hole, let them keep their commitment to us in terms of state aid, and then we'll be balanced for the next couple of years until we can get through a vaccine and until the economy can begin to normalize. Our citizen call center is still open, 781-352-2363. Please call them with any questions, comments, or concerns, and they will get back to you. In particular, if you are experiencing food security, the Mustang Food Pantry has halted for the time being as we did see our numbers coming down, and we're encouraging folks to go to the Ecumenical Food Pantry. However, you can always call the Citizen Call Center if you are having trouble with food security, and we can connect you to different resources. We do have resources available, so please call if you do need help. I'm going to jump into the hospital update I have, which is not much of a hospital update, other than as everyone knows, there was extensive damage to the systems of the building. I actually had a meeting earlier today with hospital officials. I was actually able to view some of their security footage of the floodwater coming in the bottom floor. It really did look like a scene from Titanic. It was that bad. They're still hoping to have the ER up and running in a 60-day time frame. I think I said 30 to 45, and then I said 60, and then it's 60 again. They're still going through the complicated process of having engineers assess the building, what can be reused, what can't be reused. I do know that they've got over 200 contractors working on the site, and they're doing 7 days worth of work, 12 hours a day. So the damage is substantial. Stewart is moving quickly to get things repaired, but there's an enormous amount of work. Their big plan is still really to first get the ER up and running, to second, to look at what other services you can build around that, and third is what we should probably consider the new Norwood Hospital. It's like any home, you suffer a certain amount of damage, and does it make it sense to repair what's there or to rebuild with something newer? They're looking at, they think they want to rebuild with something that would be bigger, more jobs, and more services, and possibly a higher level of trauma service for the town. That's all very, very preliminary. I mean, remember, this all happened less than a month ago, and there's a lot of processes that need to go through that. I think we're going to look at early in the fall changing the zoning for the hospital to an overlay district to allow the planning board to do a special permit to just clean up the zoning so that they can come back with something that's of substantial improvement over what's there. Many communities use a hospital overlay zone because hospitals are sort of unique in terms of how you zone for them in terms of size and scale and parking requirements and everything else. We, of course, would be very supportive of what the hospital needs. And if you think about it, nobody wants to see buildings torn down, but if they're going to tear down and rebuild half or more than half of the hospital, that's a good investment for the community. That's going to mean those jobs are retained and hopefully jobs gained. It is tax revenue for the town once the revenue is, once the new building is built. And it means that we're always going to have a hospital here in town. That being said, big $100 million, $200 million construction projects like that don't happen overnight, but we do know that Stewart has the resources to make it happen, so we'd be hopeful that that process begins kicking off sooner rather than later. We know that a lot of people have been either laid off or furloughed from the hospital, and that's challenging, and they're trying to find them positions at other Stewart facilities. So it's a challenge. It really is a challenge. What we need to look ahead is for a couple of years of difficulty as the hospital rebuilds. But maybe 3 years from today, we have a brand new hospital that's a state-of-the-art facility with more state-of-the-art services than it has now. So hopefully we'll come to see this after all the misery we've gone through as a blessing in disguise with a better hospital. I don't know if bigger necessarily means better when it comes to hospitals, but there may be services that they could add that would be sort of world-class treatment services at the hospital. And let's face it, the original part of the Doris, just have asked, would you ask Stewart to hold a town hall even remotely so residents can ask questions? So the first answer is you should call Stewart about that. They're not a municipal entity. We don't control the hospital. So I just email them and ask them that. Remember that they're a big community. And again, feel free to ask us any questions. I mean, it really is, the hospital had a lot of damage, and they're going to get the ER up and running. Then they're going to add other services. Then they're going to do, a major reconstruction. It's really all the It's really all there is to it. And, it'll at some point go through its town meeting process and its planning process and zoning process. It's still too early for all of that to happen, but by all means, just reach out to Stewart if you have specific questions. Other than that, I think the update is they're trying to get the ER up and running as soon as possible. And remember, picture if you lost your home and how stressful that is, and then how stressful it is when you lose your business, and now a company has lost an entire hospital. I mean, the hospital is important to us here in Norwood, but its catchment area is 250,000 people. So I know everyone's curious for updates, but the updates are that it's moving along. It's a challenging It's a challenging process, but feel free to contact Stewart. I mean, like any big company, they got their corporate communications folks. So you can send us questions. We can try to answer them as we have them. We have been generally referring the press to the hospital. But the update is there's a lot of work that needs to get done, and they're working on it, doing the best they can. It's a long, lengthy, complicated process. But we think something bigger and better will come out of it in the end, or at least we're certainly hopeful that that's the case. Question from Melissa: will Central Street be closed off for the remainder of the summer? It's really nice. Well, thank you. We appreciate the comment, and the answer is yes. It will be closed off through the end of the summer. We know it wouldn't make sense to do it all year round, especially in the winter when not too many people are out in January or February, and we've got to worry about plowing and snowfall. But it'll be through at least Labor Day, and then we'll evaluate then. It was originally 4th of July, and it's been so successful that it'll continue to go. I mean, all hours of the day, people are out there in a good way. And most nights, 80% of the tables are full. The common is full. Families are out there. It's really been a draw. Some of the businesses downtown are reporting a lot of folks from out of town coming in, which is good. And it's certainly good for the businesses in the area. So we think it's great. We encourage everyone to keep using it. I'm very happy with the community. Folks have been for the short term, people have been really taking care of Central Street, picking up their trash and cleaning up after themselves, which has been great. The library had another 70 members of families today with the kids pop-up library. And were they at the Prescott today, or was it the Callahan, Charlotte, for the pop-up library? Either way, they've been doing great with their pop-up library. Comment from Thelma: everything sounds great for the future, but what impact has this had for the town? Well, if you think about it, there's 1,400 jobs at the hospital. About 90% of them are going to be gone in the short term, and probably a third of their employees live in Norwood. They do have employees that live in Rhode Island. They have employees who live in New Hampshire. They're a big utility payer, so they pay a lot of water and a lot of sewer and a big electric bill, so that's obviously going to hurt our revenues going into next year. And then there's the purchasing power. They're using contractors to renovate and everything else, but remember that any business naturally buys some of its supplies and services, and that's often the hidden challenge when a business goes down. It's not just the job loss, it's not just the municipal revenue loss, but it's that purchasing power of supplies and goods and services that they're purchasing from the community. So short term, they were at the Callahan today, it's good to know. Short term, there's going to be a revenue loss to the town, there's going to be some job loss in the community, and certainly some businesses are going to feel the pinch of not having those 1,400 employees at the hospital day in and day out. Granted, those were, of course, spread out over their 3 shifts. And then residents will feel the impact as well with longer wait times at other facilities, having to travel further to other facilities. I know our police and fire are having to travel further to other emergency rooms. That creates a challenge. That creates some budget pressures for us. It creates a service issue for the ambulance now needs to travel further. So short term, there's some substantial impacts from the hospital being down. I don't think anyone would deny that, but it's it is what it is. And I wish we could snap our fingers and undo it, but we're just going to have to look forward to the future. At least we're lucky that Stewart is looking to reinvest, because you could see some companies just say, not worth it, tear it down, take the insurance money and walk away. So while there'll be some tough times out of it in the next year or two, I'm looking forward to a world-class hospital facility in Norwood. And I think if we stay positive and we focus on that, we'll deal with the punches as they come in. Question from Catherine: Dean Street update. Oh, I do have a wonderful picture here I was going to show. So in terms of things that that's my note for what this is for, Facebook Live note, thanks to Joe for that. Dean Street Bridge will be closed. This is the detour to fix the bridge. About 12 weeks. We've put the information out there on social media. Here's what I'll say about the detour for the Dean Street Bridge. It's not going to be enjoyable. It's 12 weeks of having to do a pretty substantial detour, but bridge work is incredibly complicated, more so than I wish it was, but bridges need to be safe. So it's going to be a tough 12 weeks dealing with it, but we'll get through it, and then the bridge will be fine, and it'll be hopefully 50 or 60 years before anyone has to deal with the Dean Street Bridge being shut down. I don't think there could be, and it's barely a bridge, it's really a culvert, but it's technically a bridge. The main reason, bridges are always complicated, and that's important because we want bridges to be safe. In the design, it's a bigger concern when you have utilities that have to get moved, and the complexity of moving electrical, cable and internet infrastructure, gas infrastructure, water infrastructure, sewer infrastructure. It just adds to the complexity of it. So Dean Street will be down for a while. I believe it starts on the 27th, but we'll get the link up to the wait there. Question from Kate. Hospital officials and health department working with Northern Urgent Care now that they are doing COVID-19 tests. Urgent Care has always done COVID-19 tests, and the hospital and urgent care are completely separate entities. We've reached out to them as to whether or not they could continue our resident testing program. The tests are available. We still encourage folks only to get a test if you need one. Our citizen program had only actually done about 50 tests in the time that we had run it. So the urgent care is really another option, but there are other options out there. If you call your doctor, a variety of different doctor's offices and like CVS's, not ours here in Norwood, I believe, are doing testing. There's been a wait at the national level with the labs. Part of the reason is they're bunching tests together to use less reagent to make it go further. So that's causing a little bit of a delay. And the delay is always a concern, but even at sort of back in April and May, there were times where sometimes tests were turned over quickly, and sometimes there were 4 or 5 or 6 days in testing. We obviously don't want testing delays, but it's difficult. That is challenging to have to manage it. If you don't feel there's a need for a test, you can still try to go and get a test for the walk-ins, but you can also call your doctor if you feel you need a test. Urgent care is just one of the last places there. We did have a conversation with the hospital today about some sort of an alternate arrangement, but it's tough with the complexities. But call your doctor if you do need a test. If you're having real trouble, you can always call the health department, and they'll try to find something else. Question from Fred. How often are tables cleaned as the people turn over and never sure who was sitting there? So we have the DPW out there a couple times a day. What we've done is provided with hand sanitizer to make sure that you're able to clean yourself. We know the tables tend to get sticky from ice cream more than anything. The surface-to-surface contact and transmission of COVID is actually very low, especially outdoors. So we've thought about, do we place spray bottles out there so people could spray them down? The complexity and logistics of that is tough, and really the surface contact is a very minimal rate of transmission. I would have to be actively sick with COVID, cough particles onto that table, and in very quick order, we need to go and touch and play with them and sort of absorb them to your face. So the physical transmission is very minimal. It's the person-to-person transmission that's very challenging, but we've provided all the hand sanitizer. I think we've got either 6 or 8 stations out there for folks to be able to do that. We'd like to have more staff cleaning the tables just to make them more enjoyable from a stickiness standpoint. You go there and you sit and there's some little sticky there, ice cream there. I tend to bring like a wipe or a napkin and just a little bit of water and wash the stickiness off. But if you practice good hygiene, wear your mask, and again, use these sanitizer stations that are there. We feel that it's especially given the outdoor environment, it's about as safe as it can reasonably be for any outdoor environment. But it's a good question. If anyone has any ideas on, we could certainly volunteer to clean the tables more often. The DPW is out there. Sometimes on the weekends, they're out there 8-9 times a day changing trash. And we have DPW and town hall custodial staff go out there periodically and give the tables a full wipe down. The DPW is there most mornings doing sort of a full cleaning of the street as well to keep it up and running. And we should be getting the concrete barriers painted soon. That got delayed for a week or two for some reason. But great question on Central Street. And we're looking to add more picnic benches there and a few other places as we go forward. Question from Maria: is the Dean Street detour identified on Route 95 to help others avoid the area? It probably isn't. I can ask the DPW about that. The likelihood that we would get signage on 95 to alert people is probably pretty minimal once you start getting into a state highway, but we can certainly look into that. Comment from John: thanks to the DPW for making many of the picnic tables. Absolutely, the DPW and the facilities department made all of those picnic tables, so kudos to them. We had ordered cafe-style tables from a vendor. It got backlogged because everyone in the world did order cafe-style tables. Those are still coming. We'll place some of those out, and we have more picnic benches coming, but I actually think the picnic benches have worked out better than we anticipated. They were able to make them in a week, so kudos to DPW and facilities for getting those made inside a week for them. Maureen Slattery: testing will get more delayed because many college students are being required to get tested. Yes, if If the Norwood Health Department ran the world, I think we'd be in a better shape. I think if you asked Sagala Stacey, they may say that the blanket testing for the sake of testing isn't always the best way to go. And what you hope is that our resources aren't being used. But on that case, if somebody's going to school in Iowa, to go to Iowa and they get the test if they're already there, that also becomes a concern as well. And great comment by Leanne. You can always bring your own table cover from Dollar Tree. I have seen a lot of people doing that. Again, I'm convinced, and the health department will tell you, the tables are perfectly sanitary from just an eating standpoint, not having to worry about transmission of disease. They get a little sticky, but your own tablecloth wouldn't be a bad idea either. We've thought about asking some of the businesses in the area. They've asked how they could help. Is, hey, can you go out and even if everyone once a day did the tables, it would get an additional cleaning of them. But these businesses have sort of suffered enough in the last couple of months, and it's tough for them to be able to go out and do it. So we'll keep working on it. Next year, we've talked about how we can rearrange our seasonal staff to have some dedicated seasonal staff for downtown who will be able to make much more regular patrols of that to just keep it from being sticky. We could try placing out some spray bottles. Those things tend to disappear and then they empty out, and but it's maybe we could actually have some tablecloths available too. That's not a bad idea. But people have been using it. People have been taking great care of it. Question: dog waste is everywhere, specifically in side streets in Plantation Circle and Pilgrims Drive, and also in Doherty Park. Is there any prevention we can do to protect our community? So, people not picking up after their dogs is an issue all throughout the country. We had a huge issue in the last community I worked in with the rail trail and people not taking care of their dogs. It's irresponsible pet owners. And the reason you end up banning pets from certain parks and other areas is because of irresponsible pet owners who don't take care of their little doggies and their, well, I hope they're only walking doggies. I guess you can walk a cat, but it's a big frustration. We can look at, I'll make a note to see where we have baggies available, and the little green baggies. It's tough in some of the more residential neighborhoods, but it's almost one of those problems that's necessarily impossible to solve because people aren't being responsible dog owners and taking care of their little presents from their dogs when they walk them. And that's frustrating to say because so many people do. We had a story, maybe it was earlier in the fall. Somebody was walking their dog at a park in town, and the dog left a little present, and they had a little bag, and they picked up the bag, and they tied it all up, and then they just threw the bag into the woods. That's at that point, just let the dog go. It'll biodegrade even faster. But that's a good question, Sanjeev. We'll see what we can do for stepping up patrol, maybe doing some messaging around that. We'll look at Doherty Park in particular and make sure that we have bags available and signage, but it's tough. It comes down to similar to a lot of the COVID measures where are people just being part of the community, and are they being reasonable with taking care of their animals? I find it very frustrating, and it's one of those issues where it isn't always the dogs. There are plenty of geese in the parks and playing fields also. Well, you're right there, David. Sometimes it is geese, but there are a lot of dogs that do cause problems. And that's not to say there are a lot of people who are very conscientious dog owners who always pick up after their dogs and always take care of it as well. So it's a challenge, but we'll look if we can get more of the little dog baggies out at additional parks and areas in town to encourage people to be able to do it. Yeah, Kate, a lot of people at urgent care. Yep, there's college students, and I believe Maine is asking for you to have sort of some certificate of you're okay to travel. Other states may or may not be, but I know college students need to start getting them. People are doing the serology tests as well, and that's to see if you have the antibody test, and that's mainly more of a curiosity factor. We've encouraged people to be, certainly you can get it, but there's necessarily no benefit to getting the serology tests. The PCR test is the swab test where I've jokingly said they poke you in the brain. They don't actually poke your brain. That's not how it actually works, but you do feel like you get poked quite a bit. Laura asked a question about flood damage grant assistance. No, we haven't discussed it yet. The grant closed on Monday. You can still submit if you haven't. It'll likely go to the end of the Tier 3. We've received, as of when I checked, close of business Monday, and we still had online ones. There were probably 150 applications received, and then there were a few that were being updated. So the number might be closer to 200, but around 150 received as of the last time I checked on Monday, I should say. We're working through them now. We have begun site visits, so we've probably done, by my rough estimate, 70 or 80 site visits. and they'll be ongoing this week and next week. We do believe we'll be able to get the first sort of batches of assistance out maybe early next week. As you know, we have around $500,000 worth of assistance. I wish we had $5 million worth of assistance. We're starting with the lowest income, highest need, and then moving up from there. So it's been a lot of work to get the applications done and in and coordinated, and there's a lot of check processes and step processes. We've had a lot of town staff and some elected officials who have volunteered as part of our site review teams or site visit teams where they're going and checking out visits. I mean, in terms of the damage, we have everything from some folks who maybe just had a repair to their hot water heater for $700. We have some people with $60,000 worth of damage. We had an elderly individual who was disabled, couldn't even make it into their basement anymore, where their basement needed a complete clean and gut, and their disability prevents them from even getting into their basement. So there was mold growing. I mean, that was sort of an emergency situation. So the damage has been widespread. We are working to try to identify additional resources, but now from a town hall staff, or from a town staff standpoint, we're in the weeds of going through the applications and trying to get them approved and trying to get resources out there to people as quickly as we can. If you were affected and you've got an emergency situation, if you've still got water, or if your basement still hasn't been cleaned out, you can always give us a call and we can see if we can find some other resources to help you. Kathy asked, have you provided an update on the Road Hospital? Briefly, in that they're still looking at, there's been a few delays with the ER. They're still hoping in a roughly 60-day time frame. So we're looking at hopefully sometime in September for the ER. They're still going through their engineering and design process, but the process still is get the ER up and running as soon as possible. And then after the ER is up and running, see what services you can add in sort of a phase 2. And then phase 3 will be a major reconstruction of most of the hospital. Certainly it looks like probably the LaRusso wing, and then they may look at the entire hospital. And if you're not familiar with the way projects of this nature work, I want to make sure everyone knows that, you bring in your engineers and they assess your building, and then you work with your insurance company. You say, okay, well, what's the damage? What can be replaced? What can be repaired? Do we do a full reconstruction, or can you just remodel and fix what's there? And sometimes where the delta comes in is, geez, if it's $50 million to rebuild a building and insurance is going to give you $35 million to repair and remodel a 40-year-old building, does it make sense to just repair the building and still have an old building that doesn't meet current codes versus just go ahead and build something new? It seems to be that that's where the discussion is going, where the delta is, and would seem to be making sense. And think about it in terms of your own home. If you suffered a 70% loss of your home, are you really going to rebuild 70% of your home? Or at what point do you just say, well, we'll just tear the home down and, build a brand new home from the bottom up, and it ends up being more modern, more efficient, certainly more so on a commercial scale. So still on the 60-day timeline for the ER, and phase 2, getting those other services up, will depend on what they can physically fit into the ER space, and whether they look at temporary space to add some services, or they just say, you know what, it's time to move whole hog with the with like a full rebuild of the LaRusso wing, and maybe they do both wings of the hospital. That still, again, hasn't quite been determined yet, because these things do take time to work through the process. We likely will need to look at, I think some of the zoning on that parcel is actually old residential or industrial zoning, so we're going to need to bring something before town meeting relatively soon to make sure that the zoning will allow them to go to the planning board and get a plan approved so that they can move on in a relatively quick fashion. The short-term impacts are going to be pretty severe to the town. There's certainly a lot of job loss, revenue loss, and purchasing power loss, as well as expanded times to get folks to the ER, and a lot of frustrations for our police and fire departments. And then, but big picture, where there is some shining light in the clouds, or light shining through the clouds, is we think we might get almost an entirely new hospital out of this that may have a higher level of service and new services that it didn't have before. So sometimes you got to look at a tragedy, and you got to look at all the misery and the hard work we're going to go through and all the challenges it's causing the community with everything else that's going on right now, and say, this isn't ideal, and to be quite honest with you, this sucks, but maybe something better can come out of this, and let's focus on what that brighter future is. Next year or two, not having the hospital operating normally is going to be tough. Our public safety departments are already feeling the strain of it. And that's going to be a challenge, and it's impacting a lot of the communities in the area. Every conversation I've had with the hospital leadership, they're committed to rebuilding here and building better than they had before, and doing everything and going as aggressive as they can at the process. And I think it's important that we support them there and think about the long-term viability of a hospital in Norwood. We want a hospital, and if it's time for the hospital to grow and expand to make sure that we have a hospital for the next 30, 40, 50, 60 years, then I think it's what we need to do. It's absolutely critical to the town that the hospital be rebuilt and be rebuilt well. That's easier said than done. So we've talked about you can reach out to Steward. We'll bring information on the hospital as we have it, but it really is going to be that it's going to come in dribs and drabs as they continue to work through their process of getting their insurance set, getting the building work done, and getting it up and running. Michelle had a comment here. I'd like to issue a challenge to all dog owners watching today to do what I've recently started doing when walking your dog and cleaning up after them. If you see a piece of a bag nearby left behind, just add it to your own. Before you know it, what a difference it'll make all around town. I agree. I'll be honest with you. I'm a public servant. I believe in public service. I think public servants can solve almost any problem that's out there. I don't think we can solve the doggy present problem. It's going to require people in the community deciding that that's not how they want to live their lives. That's not what they want their community to look like. And people like Michelle stepping up and doing things like that and just casually making that change. I mean, change sometimes does need to be from the bottom up. So I appreciate that. I'm going to go ahead and like that comment. Oh, didn't work. Oh, I liked another one. That's okay. Leanne, do we, the town, have to pay for the out-of-town transports to other hospitals, or do the patients have to pay for that? It all gets factored into your bill as a patient. So the way most ambulance services work is you have a mileage charge on your bill for how far the ambulance has to travel. It's an inconsequential part of our bills in Norwood because 9 times out of 10 the hospital is right there, so we're going a mile. But every other town you may live in, whether it's Foxborough or Millis or Sharon, there, if you're traveling 8 miles down and 8 miles back, you're paying that mileage charge. I'd have to see what our current mileage charge is. I know when I worked in Northern Maine, it was at 11 or 12 bucks a mile. We used to actually travel 150 miles down to Bangor and back 3 times a day, sometimes 4 times a day, when I worked for the city of Caribou. So that mileage charge was immense, but it becomes part of the overall bill the further out we have to go. So most of that cost gets recovered. Where we lose costs is where we're sending police for reports or for other issues to different hospitals where people have been taken to. There's no cost recovery for that, which tends to create quite a bit of a challenge. I've talked about no parties. We've talked about our COVID numbers. We've talked about out-of-town facilities, the Citizen Call Center, the Dean Street Bridge. We've given some updates on our flood grant. Parking lots, the senior center will be getting finished soon. I think they were finishing up today. Day Street and the post office are currently dug up. Those will be being finished weather dependent, hopefully sometime next week. And then the theater lot and the Babels lot are currently next. Town hall is after all of these. We scheduled this lot last because we need to make sure that the elevator project is finished, that the cooling tower project is finished, that there's no damage to the lot, and then we'll be taking care of those lots. But it's a great investment and enhancement in our downtown. The Day Street lot had been had not been aging well, so we're looking forward to a nice new lot there. And then once the theater lot gets done, it really helps bring, not the parking lots add to the vibrancy of downtown, but for folks coming into the downtown, it really does add to all of those possibilities there, and just makes the downtown look even better and even more inviting, which is important. And we're actually probably going to do some marketing for surrounding towns soon to encourage folks to come to the downtown area. We were going to do that right before the flood, then the flood hit. And we'd like to make sure people know about all the parking and dining options. We may hold off until all the lots have actually been redone, because the worst thing we want to do is encourage people to come to our downtown, and then all the lots are all torn up. Speaking of downtown, we now have Wi-Fi on Central and throughout the Common, courtesy of Norwood Light Broadband. The best rates and best service in town, and the largest market share in town is Norwood Light Broadband. So if you're not a subscriber of Norwood Light Broadband, I highly encourage you to do so. They are providing free Wi-Fi on the Common for residents. We also have some parklets coming to downtown, and I'm going to show an image of one of those. See if this can work. That's kind of what a parklet looks like. We were able to receive grant funding for 3 of these, and we'll probably talk with some local businesses about who wants them, and if there's a large number, we'll do a lottery system. But we're excited that we're continuing to add to the vibrancy of the Common. The sound system is coming at some point in time. I know I continue to say that. The purchase orders have been issued. It's a much delayed project, and we'll have some sound on the Common and on Central, and we're looking at a process that could extend that down most of Washington Street as well, and some additional lighting through some other funding we're trying to look at. I mentioned the Civic is open for working out. The library will be open August 3rd to begin limited in library browsing. In Town Hall, we're still looking at the day after Labor Day. The pools are open. The rec department has done a great job with getting pools and camps up and running in the community, and we're certainly grateful to them for the work that they've done. There are some communities that are not actually running any pools, they're not running any parks or any not running any parks, running any camp programs, and we're grateful we were able to bring those services here to the community and to do it safely. We're glad we did it early because now we'll be able to build next year's program even in a post-COVID world, learning some of the things that we learned in doing it. It's been challenging and it's been difficult, but we're happy that we're able to bring those services to the public. One final item I'll go over and then we'll open it up to questions, although it's always up to questions. I did show this earlier for anyone who's just joining. This is the case count for Texas. And I don't know if I have my Florida chart here, but I'll show you the Norwood chart. When we talked about flattening the curve, that's exactly what we were able to do here in Norwood and throughout Massachusetts. We flattened the curve. We've got to keep it flat, so that's important for everyone to make sure we continue to wear masks and we continue to practice good social distancing when we can, and just be a good neighbor and be a good citizen in helping out everywhere we can. With that, I do apologize. I'm sending a message to somebody at the moment. I will take any questions we have in the comments. Let me make sure I scroll through and make sure I've gotten them. We talked about the hospital. So we'd be more than happy to take any questions folks have for about the town. We've covered COVID numbers, our numbers, town facilities, the Citizen Call Center, the Dean Street Bridge, the parking lots, the flood grant, the hospital, library was awarded a grant, parklet's coming to downtown, Wi-Fi is now on the common, Civic is open, the library is open on August 3rd, and Town Hall after Labor Day. So I'd be more than happy to take any questions everyone has. We'll give it a minute or two as we usually do and then see if anyone has any questions, and if not, we can certainly always take questions. So looks like, all right, looks like there are no questions. You can always throw questions. Oh, yep. Any updates on the sidewalk projects? Many are still lifted, cracked, raised, etc. at Deed Street Road. Lots of walkers and bikers out there. Yes, so our whole road program was delayed several months. It's now starting with our 2020 road program. Everything just got kicked out a few months because of COVID, and mainly actually just because of COVID and because of COVID. So we're beginning work on our road work. I think there's some work either being done this week on Laurel Road is where they are, but we've issued bids and signed signed documents. So we're starting our round of road work. I'm not sure specifically about Dean, Neponset, and Cherrywood, but we are out there and getting starting our annual road work, which was delayed a few months. Does the Wi-Fi need a password? The answer is no, it does not. It's under Norwood Light Broadband. We may change it to clearly say free public Wi-Fi. We're looking into that. We're putting some stickers out there to let people know it's there, but there's no password required. I was able to do some go-to-meetings and work from there a couple days ago on a morning, and I found it worked absolutely fine. And I tend to be a little bit persnickety when it comes to Wi-Fi not working. Overseeing both an IT department and an internet company, I've gotten a little complacent that when I have an internet issue, I have a lot of people to complain about the internet issue too. So I found it actually, Norwood Light and Broadband, Daryl Hansen and his team over there did a great job. I think the Wi-Fi works awesome there. I was out there with my phone streaming YouTube and streaming Netflix, so it seems to be working great. So I encourage you to use it, and it's a great place to sit outside and work. You can go get a coffee from the Common Cafe or Spot or the Town Diner, or go get lunch from any of the places that are in there in the area, or an ice cream, and I encourage you to do all of that. Any other questions from anyone on the live? And again, you can always, is it secure? Yes, it's handled directly through Norwood Light Broadband. So it's, I've been told it is as secure as the network we use in the town, because the light department has made sure that it's in really good, it's really well taken care of. And remember that we're, because it's our own broadband company, we have an additional layer of control over what we do. So we're not just subbing it out and hoping it's, hoping somebody else takes care of it. So, and if you have any questions specifically about the security on the line, you can always email us and we'll get you an answer from broadband. But I've used it myself with my laptop and my phone with no issues. But great question. Other questions. I guess I don't know how to do a Facebook poll, but there will be a week or so in August where I may not be able to do a Facebook Live update because I may be on vacation. And we're thinking of who could do the Facebook Live in my absence. And I'm thinking it could be Bernie, it could, system manager, could be Segal. We could get somebody in here to do it. So if you have any thoughts on who could do the Facebook Live update in my absence for a week in August, and then I'd be able to log on and ask questions of the person, by all means, let us know, and we would be happy to hear that. That being said, we're not that we have a set time limit. We're at about an hour. If you have questions, you can keep asking them in the comments. We will generally respond to them when we can. You can always email us at managers@norwoodma.gov. If it takes us a little while to get back to you, that email account has been seeing a flurry of emails with the flood grant. So I normally on my own email account, not counting the managers, get 50 or 60 a day. We're probably seeing over 100 a day, so it just might take us a little while to get to it. If you don't hear from us, have no problem just resending the email and it'll pop back up to the top of the list. But you can email us at managers@norwoodma.gov. You can always comment, and we'll continue to try to get to the comments. And we appreciate you folks joining us every week for these updates. We find them helpful, and certainly we love the opportunity to get some questions answered. I hope everyone has a wonderful weekend and stay safe out there. Remember to wear your masks when you can. And great, yeah, NPD and FD chiefs, yep, they're both great. Chief Maurice and Chief Brooks. But as are all of our town staff for getting us through this and continuing to work. So with that, I hope everyone has a wonderful weekend. Take care, everyone. Feel free to email us with any questions. Remember, we're here to help and we're here to serve. Thank you, everyone. Have a great weekend and have a great night.